Welcome everyone to the Future of the Planet webinar series. You may see two of our three panelists here. I'm very happy to welcome Daniel Kraft and Craig Rouskey. Nell Watson will be joining us shortly. The Future of the Planet series is built to talk about the long-term and near-term future of our planet. And today's session is going to focus on some of the technologies that are necessary to reopen society. As we know, a lot of national and state and local governments have been allowing people to open up businesses and to gather in small groups. How do we do that safely? What will life look like as we return to public transit or to visit healthcare practitioners or to go to the grocery store? And so today we're going to spend a little bit of time talking about what those technologies are. I'm very pleased to have some visionaries and scientists who are on our panel who are not only predicting that future, but helping to bring it about. And so I'd like to introduce Daniel Kraft, physician scientist and entrepreneur, who works with Singularity University, who has founded the Exponential Medicine, a conference that brings leading edge technologies in a hands-on setting to healthcare practitioners. And as we will talk about, the lead of the XPRIZE Pandemic Alliance. Daniel, would you like to say a quick hello?
Thanks for having me. As you mentioned, yeah, we have to think of the future of the planet, healthcare, and how we can leverage all our existing technologies, talents, beyond to figure out the now, what's coming, and hopefully even the future side of preventing pandemics. And I think the silver lining of what's happened so far in this crisis is how many folks are coming together in new ways and collaborating, mostly virtually, which will lead to hopefully a lot of positive benefits, whether it's for regular health or global health and beyond.
Absolutely. Nicely said. And I'd like to introduce Craig Ruski, a multiple-time entrepreneur and IndieBio alum. Most recently, Craig has founded Renegade Bio, which was founded very quickly in the middle of a pandemic, which is not when most people choose to found their companies, but Craig saw a need for diagnostics to be not only implemented accurately and correctly, but scaled up. And so we will hear a little bit about his story, how he founded Renegade first in California, and now I believe you're focused in New York, correct, Craig?
That is correct, yes. And my last name is Rouskey.
Rouskey, sorry. Sorry.
It's all right. Yeah, thank you for having us, and I'm excited to be here. So
great. And we'll be joined later by Nell Watson, and I will introduce her when she is able to pop in. I kind of like that she's being late. It makes it like a real life situation when sometimes someone gets tied up in traffic. So today we're going to focus on how we can open up safely. What are the technologies that we need? How are they going to affect our lives going forward? Which of these are needed right now? And which of them will incorporate into our everyday lives as we continue post-COVID? And I think the name of the game is really immediately test, trace, isolate. So Craig, being focused on diagnostics, you're really in the midst of that test part of the triad. So maybe you could give a brief overview of what tests are out there, because I know there's just like a smattering of different things that you can test for and how they are implemented at what stage of disease, just so everyone starts off on the same page. I know a lot of our attendees have some working knowledge of this, but just to make sure that we're all on the same page.
Perfect. Yeah. So there's basically two broad categories of tests, I would say. The first is a viral test, which relies on collecting a sample of nucleic acid or virus from a patient. You may have seen videos of people receiving a nasal swab or an oral swab. Those samples are brought into the lab. They are processed for RNA and then amplified to detect the virus. So those are live viral tests. The other test is an antibody test, a serology test. You may hear it called serology, which looks at antibodies and allows you to determine whether or not someone has come into contact with the virus. Now, there's a lot of data out there about accuracy and sensitivity of both tests. I would say viral tests are very important in going forward and trying to mitigate the spread of the virus throughout the community as we continue to open up our economy and our communities. I think the serology tests are important to assess post-COVID how many people have been affected. The problem with this is there are not a lot of tests that have high accuracy and sensitivity. So you may have someone, for example, who was exposed to the virus who hasn't developed an antibody response. So you won't be able to detect based on antibodies, whereas a viral test would say in the moment, this person has the virus and is sick, or asymptomatic for that matter.
And when you were forming Renegade Bio, you were really focused on who is currently infected, correct?
Yes, just for a little bit of backstory for folks. So we were founded on March 18th. The World Health Organization declared the pandemic on March 11th, the same day that the Centers for Disease Control released their primer and probe sequences for their viral testing. We took one look at their protocol and said, hey, we can do this better, faster, cheaper, and bring it to more people. We were incorporated on March 18th, did a small research study in San Francisco. By March 24th, we were completed there. March 28th, we were recruited to New York to start helping first responders here and have been testing ever since. So that's where we're at in our process right now.
And you've situated in Manhattan, is that correct?
We are.
Genome Center, I think, Lower Manhattan?
Yes, exactly, Lower Manhattan.
And so a follow-up question on that is, how have you been able to scale up? I know a production of these tests is not simple, but you can follow a protocol and do this with a single, maybe even a dozen tests, but you're really trying to ramp up so that there are the number of tests necessary so that we can accurately gauge who is potentially carrying this virus going forward.
Yeah, so we were very fortunate to receive support from investors, including SOSV and IndieBio folks, that allowed us to prepare for scaling really early on. So we've been able to work out this sort of growth and scale curve where we're buying more machines, more reagents, bringing more tests in-house, and sort of growing our capacity as we continue to grow as a business, as a company, as a public benefit corporation, which is what we are.
Okay. Well, I have more questions about Renegade Bio, but I want to transition to talking about the isolate part. So I think that Nell will talk a little bit more about the on the test, trace, isolate. She'll talk a little bit more on the tracing. But Daniel, I know that isolating is a problem not only for the people who are quarantined or suspected of being exposed, but for all of us. We've been living basically in our homes with maybe a jaunt out to the grocery store every once in a while. And I'm in New York, and so is Craig. I think you can speak to the experience on the West Coast being quite similar. So this means that a lot of our interactions are virtual. And so while there are perhaps a greater need for some people to maybe go to the emergency room or get one of these tests that Craig is talking about, there's also the need for normal healthcare practices. So maybe you can talk a little bit about how telemedicine is filling that gap.
Sure. I mean, telemedicine, a lot of things have been accelerated in this pandemic that are going to change healthcare and many other things forever. Maybe I'll just share a few slides to answer some of that in context.
Great.
I think there's a lot happening. So you can see that. So, no question that the world's changing. Lots of disruptions happen. Technologies enable that in general, and clearly COVID is accelerating that. I love this slide. Who's led the digital transformation of your company? CEO, the CTO, or COVID-19? And in most cases, the answer is C. Part of the bigger picture is this change, and hopefully from our sick care model, based on getting very intermittent episodic data when you happen to go to the clinic or the ER or end up in the ICU, which leads to a very reactive sick care model, including waiting for the disease to happen, including pandemics, to one where we can really shift using the new telemedicine connected tools to be much more continuous with our data. That could be from our Fitbit that might pick up our early COVID symptoms, and personalizing that, making us more proactive and democratizing healthcare, but particularly important in leveraging that in the face of COVID, and digital health as a buzzword per se is certainly ramping up in this era. We have a lot of new data sources. A lot of them are obviously connected to our sometimes 5G Internet of Things. The challenge is, including with pandemic and infectious disease data, we have tons of sort of data coming at us that doesn't always translate to knowledge. And a big challenge and something that's been accelerated by COVID is collecting data, whether that's intubation practices or how to practice telemedicine, turning that into information that can be spread around and democratized, and narrowing that gap, which used to be like often 17 years between something being published and established, to actually translate on something that you or your clinician could use. And sort of the meta trend is going from hospital to home to our phone, and the COVID response is requiring that. A lot of folks clearly don't want to even go. I saw a story. This guy turned down his liver transplant because he was afraid of getting COVID and didn't go to the hospital, didn't get his transplant. So
Wow.
we have the need to sort of leverage a lot of the technologies. A lot of what IndieBio and SOSV has been funding and catalyzing is this convergence of lots of technologies in biotech and digital and beyond to kind of create entire new fields, all of which are sort of accelerating in the COVID era, whether it's AI in radiology using a portable ultrasound or an X-ray or CAT scan, using AI to determine is that the pattern of COVID, to digiceuticals, to new sensing technologies, or just connecting the dots with what we already have. And part of the challenge is there's 1,000 flowers blooming, bunch of new ways of doing testing or 3D printing ventilators or et cetera. So I've been leading the XPRIZE Pandemic Alliance Task Force. We've got 60 different organizations looking at how do you sort of combine forces, find the unmet need gaps, whether it's in testing, tracing, isolation, including thinking about all the design elements, the design thinking, ideas involved, all the way to addressing social determinants. And there's interesting things that can come together. So to better answer your question, now there's all these new ways to sense. Only 11 years since the Fitbit launch, we now have all these new ways to quantify our health. Usually it's very much siloed on our phones. It's starting to flow to your clinician. So if you might have symptoms of COVID or you're diagnosed positive, most folks do okay. They don't need to come to the hospital. How do you have that data flow to your clinician once you've been diagnosed, or your healthcare system, whether it's as simple as a O2 sat monitor or something more complex? And I think the trend line is now we can hopefully measure these things remotely and diagnose whether it's COVID or any other condition, and then treat it in a much smarter, connected way. And so there's a bunch of examples of things you can measure. My favorite local example is a company called Spire. I call them underwearables. That these sensors have now gotten so cheap that you can put 10 of them into 10 pairs of underwear. They started as sort of a wellness company looking at mindfulness and stress and breathing. But now that the reimbursements have shifted, new CPT codes came out last year, and even new ones that have amplified during COVID. So you can pay for remote patient monitoring and detect respiratory distress from your underwear sensor or from other means. And so there's even digital forms like your voice. Is there a sound of your COVID-like cough? Or if you have COVID, what's the sound of your cough when it's really getting serious enough that you really need to go in and get care? So triage is a big part of this, because lots of folks are getting it, but not everyone needs to show up in the emergency room, and many folks are avoiding it even when they should go. So big picture, all this new digital exhaust, the ability to integrate that is key. How do you take the equivalent of a check engine light for COVID or other diseases and make it accessible? How do we learn from our digital exhaust? There's several studies. This one, the Detect study, that anyone can sign up, go to Apple Health Kit, find the Detect study, see if your Apple Watch can find signs of COVID early and proactively, all the way to using a whole new set of diagnostic tools. My favorite new example on diagnostics is not going to be necessarily just from your data, but even looking at basically PCR of sewage, which seems to indicate a week before the cases come where there might be an outbreak. And so we'll have new ways of doing community-based public health through the sewers. You can think of all the great puns here, but that's going to be part of the way we go. And again, all the digital tools, all the ways now to bring in, talking about telehealth that you mentioned, not just talking to a doctor or nurse on the phone, but leveraging a pulse ox technologies like Echo, where you can do basically an AI-assisted EKG and stethoscope, new ways to integrate those sort of kits for caring for family members. New ways of doing labs, as we're hearing about, are going to explode. And the challenge is actually, we're thinking about doing an XPRIZE challenge, or prize itself, testing the test. There may be dozens out there. We just heard about a new one coming along. How do you measure them? How do you get one that's super cheap, rapid, accurate, and can be scaled? There's several companies. We just heard about one. This one is coming out shortly, or going through the process. So leveraging also our digital ways. So you take a picture with your smartphone and the data gets uploaded. So I'll stop there. There's too many slides I've already put in there. But telehealth plays a role. And you don't want just, again, that connection of talking to the doc. You can use asynchronous care. Chatbots can guide you through a symptom checker and then up-level you if you need to. Lots of examples of mental health. Mero Health is a local San Francisco Bay Area company looking at digital mental health, not just for depression, but now for anxiety and other things. So that's going to be the next wave of the pandemic as well for healthcare workers and beyond, and the ability for us to prescribe nutraceuticals. And I've recently launched a very alpha version of a new website, digital.health, so we can have this sort of digital armamentarium, a digital formulary for folks to use. So I'll kind of leave it at that. That was too long of an answer. But I think that the big picture opportunity here, including with clinical trials, whether it's for a test or a drug or a vaccine, is to connect the dots, digitize them, accelerate them, because we have to kind of start to crowdsource and integrate all these technologies to get to where we need to go. So I'll leave it at that. Long answer to a short question.
But lots of interesting threads to follow on that. Thank you, Daniel. For example, I mean, you started right at the beginning talking about accessibility, and I think I read a stat saying that in-person visits to healthcare practitioners are down 2/3, and are remaining that way. As soon as COVID hit, people started doing more of these digital meetings, right? Digital assessments, both, I imagine, using certain types of web portals, and also some of these measurement statistics, being able to upload some of their personal data. So do you see this being a trend going forward? Do you think people will ever start going back to their GPs, or are we just going to use our phone in order to move forward?
Yeah, briefly, I mean, telehealth is not new. You used to do telephone calls.
It's not, no.
And even though people had it available, they weren't really often using them. Now they've been forced to, and I think the genie's out of the bottle. It's not going to go back in. And it's being amplified by some of the tools I mentioned, because you don't have to just do the screen-based visit. It could be, again, with your virtual avatar for your first elements. It's going to be connected to tests like the ones Craig are developing. So when you are positive, you kind of get the right levels of health. And the regulations have changed. HIPAA relaxed it so you can do Zoom televisit calls without being committing a crime. And then reimbursement is the big lever. Medicare and CMS now is paying for virtual visits. And there's a big challenge in pediatricians, the primary care docs. I train in internal medicine, pediatrics. Many of my colleagues are struggling because their office visits have gone down. If they can now bill for and be rewarded for doing good virtual care, that's going to integrate better into the blended model going forward.
Blended model. I like that phrase. I think that that's something that is important during times of transition. And I could see, for example, Craig's test being something that is right now, I believe that you're collecting tests from people at their homes. Is that still the model, the business model, Craig? But imagine that someone could upload it. Maybe you could speculate on how that might move forward, integrating some of these digital platforms.
Yeah, so actually we're negotiating with a partner right now to bring in a digital platform where people can requisition tests or request testing for themselves through our online portal, through our app, web app, schedule a time to be collected, and then receive the results through the requisitioning physician who handles their registration up front, give the results back to the patient, and then they can track their health status. But what we're really seeing is like, the majority of people who are going back to work and going back to life as normal are probably going to receive these tests through workplaces, through their employers, right? And that's a really huge access point for most people. Yeah.
In terms of, let's say, the employer, how frequently would that have to be done in order for people to feel confident that they are not an asymptomatic carrier, for example?
Yeah, exactly. So people are talking about once a week for viral testing. And we actually have a sort of triage program where we say, if you have had COVID or have been exposed to it, you go through the test, we see if you have antibodies, you're considered immune, and you're probably the first wave of people going back to work, right? If you have not come into contact with coronavirus to this point, or SARS-CoV-2 to this point, then you would actually go through a viral test. If you were positive for that viral test, you would be quarantined for 14 days, tested again 2 weeks later, at which point, when you become negative, you're tested for antibodies and released with an immunity certificate. If you're negative for SARS-CoV-2 antibodies and for the virus, you're actually considered susceptible, and you're one of the hardest populations to get back to work, right? Like you're more likely to contract the disease. So it's definitely something that occupational health and safety offices in organizations, within organizations, are thinking about and starting to implement in a really big way here in New York.
Okay, well, that's good to hear as someone living in New York.
Yes.
question
Daniel,
for Craig. Can you describe briefly how does your test work? How is it different from others? Is it PCR based? Does it have to be sent in centrally? And what's your vision of where that might be in a year?
Yeah, so the really nice thing, we are a PCR-based assay. So we basically took the CDC protocol, streamlined it with some molecular biology tricks. For those of you who don't know me, my background is in molecular biology, microbiology, and immunology. I've been working in the field for 15 years. And so when we saw the CDC protocol, we said, hey, they're doing this wrong. Like, we can streamline this by cutting out this step, by speeding through this step, and by multiplexing, which is essentially what we do. We created a multiplex assay. And so throughput's really good. We realized that there's still the issue of having to have that face-to-face interaction with people. So working eventually on deploying a system where you can collect your sample at home, send it into our lab, and we do the testing there. We're not quite there yet, and logistically that's a real big challenge for a small startup to handle. But ultimately, you know, we see point of care tests coming online. In fact, we're working with Casper Biotech, which is a CRISPR-based test, to bring sort of point of care testing to the market, right? So we see the need for things to go, or for testing to go in the direction of point of care, but the gold standard is PCR and will always be PCR, right? The limit of detection that you get, the sensitivity, as you would call it, the analytical sensitivity, the analytical specificity is there, and it's the gold standard for a reason.
do you plan to move into the antibody testing at Renegade?
We are. So yeah, we're working on bringing in antibody serology testing mid-June, early July.
And I know that Daniel also mentioned regulations needing to change as these as new tests come online, as people move into the digital space. And you have experience having filed for the emergency use authorization. How was your experience with the FDA? And do you expect them to be more nimble in response to, you know, everyone having to move very quickly going forward? Maybe they've learned their lesson and will move a little more quickly, so there won't be this tie-up next time.
I have to say, the regulatory path to getting a test approved under this pandemic, in the context of this pandemic, has been really amazing. People at the FDA are working on Saturdays and Sundays. I send an email to the FDA Sunday at 6 p.m. and I get a reply, 40 minutes later. It's amazing. So wow. People are working hard. They realize the importance. And they're doing everything they can to support people bringing their testing online in an ethical and responsible way.
Yeah, and so another thing that Daniel mentioned that I think you can both speak to are the, let's say, HIPAA regulations and data privacy concerns, right? And so how can tests as they are going online, as people are getting their results digitally through some sort of platform, be best protected so that that information only stays with the individual who should have that information?
Briefly, I kind of hate HIPAA with a passion as a physician. I think it went way overboard in the past, and I've seen many patients die with their privacy intact when they might have rather been alive with someone able to access their medical record. But I think Nell Watson's joined us now, so maybe Nell, who's in that space to some degree, can mention. I think HIPAA has been relaxed to some degree. I think we need to be smart about how we do contact tracing, but it's a public health good, and this is a time when some rules need to be flexed a little bit in the setting of crisis to get R0 below 1, and how we balance privacy and speed is a big question.
Wonderful, and yes, thank you for pointing out that Nell is joined. Hi, Nell, glad you could make it. A brief introduction, Nell is also at Singularity University, and she is on the coronavirus task force for the American Association for Precision Medicine, and a founding council member for the International Society of Digital Medicine. So I'm sure you can speak well to some of these concerns about privacy and what Daniel was just leading into.
Absolutely. I think this is one of the greatest questions of our time, is how do we roll out an unprecedented suite of technologies with so much invasive potential and balance that with the dire need to understand how this pandemic is emerging and to manage it in a better way than we've done before. And those are tremendous difficulties. I've been doing some work with the IEEE to help create contact tracing technology ethical frameworks. And that's going to be released soon as a gift to the commons. And I hope that those frameworks for national governments as well as corporates will help to ensure more fairness and equity in how these technologies are used.
It's kind of a fine line to toe, as you mentioned, between promoting public health and getting people's buy-in and making sure people have ownership. And so I wonder if you have like best practices for getting that buy-in that you might talk about.
Trust is essential. There has to be a very strong level of trust. And we're dealing with a global market potentially for these apps. And if one or two nations don't play ball and they do naughty things with that information, that is likely to make citizens in other countries, even relatively honest and straightforward countries, much, much more reluctant to install that technology on their phone. And so I think it's very important that we monitor our peer systems and look over each other's shoulder to make sure that we're doing things in the best possible way. Not even that somebody might be using something for malevolent purpose, but simply because things are being done at such a breakneck pace, you know, accidents are bound to happen. And sometimes there may not even be a clear chain of responsibility of who necessarily is authorized or accountable for doing something. And so I think that's going to be one of the most important things, is to have a unified response to how we ensure that all of us remain accountable to our peers.
I really like that word, trust. I think that is kind of the key take home, that everyone needs to have trust in the assays that we are running, trust that the people who are running the assays know what they're doing and are going to use any information that they gather for good purposes. So I think that's a key word that you've honed in on there, Nell. One of the questions that I think you answered in the chat, Craig, was about that trust, the accuracy, right? There's been a lot of discussion in the press about how we can get accuracy of these tests higher. And I think that could possibly erode some public trust in the medical or the healthcare system. So how do we, at all levels, right, at the practitioner, at the regulatory, at the government level, embody and gather that trust of people in this system?
Yeah, I think, you know,
it's a big question. I mean, there's probably not one answer, obviously.
Yeah, so, I mean, just to take it on the different levels, right? So we work in the public trust at Renegade Bio. Like I mentioned briefly, we are a public benefit corporation with very specific public benefit purposes of bringing testing to all people, regardless of ability to afford or have access to the tests, right? So we work in a very open, honest, and clear way. I think that's the first level. I think as you scale up to the to the governmental level, both on the local, states, you know, and federal level, I think that's where trust and accountability are lacking right now. And I think that's where people need to see it come from, right? People need to see that we have leadership that cares about the well-being of all people and works tremendously to make sure that all people are safe, right? We see that the FDA, like I mentioned, is working really hard to implement policies that make sure tests are reliable and accurate. But where is the federal coordinated effort to stop the spread of this virus, right? I think that's me rambling about politics, but
well, both a ground up and a top down measure is what you're saying. So it's not
exactly.
just unidirectional, but it's really a bidirectional response. I think that's a very true statement.
Exactly. And one thing that we've seen, you know, and again, from a small level to a large level, is people coming together to really stop the spread of this virus and to work together to get through the pandemic, right? And I think more small community-based organizations are forming, these sort of trust networks that can grow and participate or collaborate with other trust networks. That's how Renegade was formed. We went from, 2 people to 25 people in less than a month. And it's because of these trust networks, and we know who our community is and we know how to work with people. And I think building those networks is really important, both physically on the human side and technologically as well.
Yeah, I imagine that hiring people to work in a lab on such an important project in such a short amount of space required having a large network of people to tap into.
Definitely.
Yeah. So another aspect, I think, of going back to work or opening up society again, that's going to affect everyone, regardless of how the disease may have personally affected your life, is the PTSD that we're all experiencing. That we have anxieties in ways that we may not recognize with interacting, and I think again that there's a lot of space for some of these digital health platforms in order to promote better mental well-being, right? So maybe we could talk a little bit about some of the ways that we can promote good mental health for people who already have good physical health but have a hard time surmounting the trauma of the pandemic.
I mean, one obvious aspect is to be proactive on this. I mean, PTSD wasn't a focused on entity, around the Vietnam War era, and now we've seen it recognized in all sorts of settings, and certainly some of the quote, frontline folks can have it, but many folks are impacted, whether it's just homeschooling your kids and being locked in a small apartment in certain parts of the U.S. to all the uncertainties economically. So I think one aspect is to sort of get ahead of the curve, recognizing that the wave is coming, and some it'll be severe, and some just, I think there's a statistic out in some report that 1/3 of Americans are suffering from clinically relevant stress, depression, or anxiety in some severe form. So how do we democratize tools quickly? Well, whether it's simple mindfulness apps and tools to making sure people taking over the regular physical exercise or interpersonal skills, and potentially personalizing that, because mental health, just like medicine, needs to be more precise and tuned, and depends on your age, culture, language, generation, etc. And so the more we can be ahead of the curve, the better.
Yeah, absolutely.
And to identify hotspots essentially as well. I mean, we know there's certain very high risk populations, and what the pandemic's also is obviously exposed are the many social disparities, and the folks who are suffering most have often had the most disparities, including access to mental health and regular health care. And so part of the potentially good things that will come out of this is a better focus on lowering those disparities and addressing the mental health aspects, which tie into almost every element of disease as well, including
right.
Stress, heart disease, and risk for stroke and beyond.
Yeah, that's an excellent point.
If I may,
please.
We have many challenges and also some opportunities that we can take from this as well. We are undergoing massive societal trauma, whether that's from grieving for lost friends and family, or people who've undergone horrible medical procedures, or people reeling from the loss of their job, the loss of their status, the loss of the future that they expected to have. But at the same time, we have a chance to understand the things in our life that are actually important, the things that give our lives the most meaning, and let go of the things that don't. We're not necessarily as materialistic as a culture as we were a few months ago. We're not necessarily so easily swayed by advertising that says that, some fancy bauble, technological or jewelry related, is going to make our life better. And perhaps we're eating healthier food because we cook it ourselves and eat less processed nonsense. And maybe we have taken joy in being able to stroke an animal or go out for a walk in the country. And so I think that maybe this slower pace of life, a enforced opportunity to smell the roses a little bit, as well as the realization that maybe we're tougher than we think we are, that maybe we can endure difficult times. Maybe, who knows, we might emerge from this stronger and a little more healthier on the whole.
I think it's awesome that I didn't have to say that and someone else on the panel already believed it. You know, there's this idea of going back to normal, going back, and I see it more as moving forward, right? Like we've had the opportunity to learn all of these lessons. Let's make sure we carry them with us into the future, and do better, right? Let's take care of the planet. Let's take care of each other. Let's do better. We can do it. We've proven that we can do it. So yeah, let's continue doing that.
I like the arc of this conversation because that's where I want to go, is the future. And I want to just make a note to our attendees that we will have Q&A at the end. So if you have additional questions, please drop them in the Q&A box there, and we'll make sure to get to those. But it sounds like some of the future tech, I guess you could say, is going to be very low tech, right? It's not going to necessarily require that we all have PCR thermocyclers attached to our phone in order to diagnose COVID, but some of them will. Of course, we are going to continue to also need some high-tech responses, right? For example, predicting second waves, right? I know that as we are reopening, a lot of people are happy to be able to leave their home safely, but worry about what would happen if there's a resurgence. And we can both use some of those molecular detection devices, such as various diagnostics, but also look at some digital maybe behaviors or some of the metrics that people are keeping in terms of temperature and uploading. So maybe we could talk a little bit about how we can even be proactive, not only in our behaviors, but in using some of these technologies to prepare or detect what might happen or come again.
Yeah, I think, you know, first of all, everyone's scared of a second wave. And in order to get to a second wave, you have to finish your first wave, which I'm not necessarily convinced we've done. So that's let's take care of the problem in front of us, right? And as I mentioned earlier, I see a lot of organizations coming online with the desire to institute levels of controls, what we would call like engineering controls or administrative controls, or even PPE, right? Mm-hmm. These are the 3 tiers. You may go to a store with your mask on and see that the cashier now has a plastic screen or a plastic divider between you and them, right? And engineering control. Mm-hmm. Administrative controls, washing hands, getting tested, right, regularly, knowing your status constantly, is one way we can sort of prevent further expansion of the virus into the closure of the first wave into a second wave, right? I'd like to hear other people talk about the sort of technological things as well. We're very focused on testing at Renegade, so that's where I operate from, but yeah.
I think you're very focused. But before Daniel, I'm very interested in hearing what you have to say. But maybe you should say just how many tests you're doing in New York City. I don't think we really emphasized how much you're adding to the ecosystem in a place where there was basically very, very little testing before you arrived.
Yeah. So starting in June, on June 1st, we're supposed to be having 1,500 tests come through our lab a day as we scale up to 3,000 tests in mid-June. So we've been focused on a very small population of first responders here. We've run about, I don't know, our operations folks would yell at me for not knowing this answer, but I would say 500 to 700 tests. And as we continue to scale and grow our operations, we'll be able to increase throughput to thousands a day. We have the capacity now to test about 6,000 samples a day, and we're not fully reaching that capacity yet. New York City is very forward thinking. They're implementing a pretty strong track and trace program where they have these decentralized collection sites throughout the city and need labs to actually run the samples. So that's how we're plugging into that network. But yeah, if you know community members in New York or California that need to get tested, please let us know and we'll make it happen.
Excellent. I know because opening up is going to require a certain number of, only a certain proportion of the population testing positive, at least in New York City. It's one of the stipulations for reopening the city.
Exactly.
So Daniel, I'm sorry, I cut you off. I'm motioning because you're to my left. And you are going to talk, I imagine, about digital ways that we can predict where diseases might pop up, or things that we could do to prepare, even maybe not for COVID, but other pandemics going forward, or other diseases that crop up.
Sure, just a thought on sort of opening back up. It's one thing to open up a city. It's one thing to open up a local school or university. We're 3 months away from, the schools and universities trying to open up. So one of the needs for testing may be this, again, blended model. How could you have a test every other day, molecular at home or at the school, that, it's not just the test itself is validated, but how do you integrate that into the flow and where the data goes, and how you open up one school or one pod at a time. That's going to be critical. And then hopefully taking some of these digital fingerprints and other elements. I'll just share a fun slide with you, if I can, for a second. Because we have all these, some of them are based on our social media, even. So it's sort of hidden graph telling, knowing demographics, exactly where someone might be, what they may be posting on social media. And then we might get a little ping if I'm about to meet with Julie in real life that reminds me to maintain my social distance, or who you can be close to. So there's some very dystopian ways that could go, I think. But I think in general, we need to be imaginative about how we understand who's at risk, and how to localize that for the communities that need it. And a lot of that hopefully will be some of these digital biomarkers that aren't need necessarily based on molecular tests. And then the design thinking, so the patient journey from prevention to symptoms, to diagnostics, to monitoring, to therapy, or even thinking about folks who return from inpatient stays, folks who've been intubated from sometimes months, and how do they recover? What are the long-stream elements, and returning them to society. It's still a novel coronavirus. We're only 6 or 7 months into it. We have a lot to still learn about its short and long-term pathophysiology. And then more broadly, hopefully the tests that Craig and others are developing will be programmable. So if there's another pandemic coming, you'll have a home-based test that you change out the cartridge and it could pick up the next SARS, 2022, without waiting. Because here in the US, we had a huge challenge and many lives lost because testing was not available. The CDC fumbled. We need to have more rapid ways to getting this. And one idea I've been starting to promulgate is there's not enough public health folks out there in general. We've cut the budgets of CDC and others, not enough contact tracers. I think maybe part of this future is that we can have, almost a global health corps, volunteers, just like you have volunteer firemen and EMTs and paramedics, that many of us can be trained up to be virtual sort of public health workers when we're needed, just like folks trained in CPR, et cetera, who can be trained up to respond, up-leveled by digital tools and molecular diagnostics to sort of get ahead of the curve, whether it's for second wave or for next generation epidemics or pandemics.
Yeah,
and I would add to that, sorry, Nell, go ahead.
Oh, and I was just going to say that I think we even have an opportunity to use machine learning tools to analyze, for example, the heart ECG data coming from your smartwatch, to look for a febrile signature, a telltale sign of fever, even before one necessarily becomes aware that one is sick. Because quite often, a lot of these tests require antibodies, right? They require you to already have been sick and for your body to start successfully fighting that virus off. But if we could detect that somebody was becoming sick even before they were aware themselves, that could potentially be a game changer in terms of managing the epidemiological process. I'm sorry,
having
Greg,
some
please
sort
go
of
ahead.
Oh yeah, no, I think that's awesome. I hope that works. I think the interesting thing for me, obviously, is finding a way to stop the spread of any epidemic, virus or bacteria or whatever the case may be. I think it's really important, and info technology, I think, has to walk this line of what do you do with the information, right? Like, Craig tested positive for COVID today. do we ping everyone and say, stay away from Craig? Or, you know, like, how does that work? And how do we create a community of trust and acceptance and support when we're potentially alienating people and saying, oh, you're sick, get away from me, when we should be saying, oh, you're sick, you need more care, you need more from us, right? So it's interesting, and it's not my field. Obviously, I'm a science guy, but you know, I think it's really interesting.
Yeah, thinking how can we avoid the stigma that comes with infection, right?
Exactly.
Not just stigma, but the misaligned incentives. If you're selling someone who might be a gig worker, like they can only, or a health aide, they can only go back to work if they've tested negative, etc. Who's paying for that test? Are folks going to avoid it? Are they going to hack the test by giving someone else's blood or sputum sample? We have to think about the folks who are going to be incentivized not to get tested, because that's going to impact their ability to work on site, and often that leads to spread.
Or even risk their lives, or by exposing themselves, right, to get those antibodies and become positive. Maybe they think they won't come down with a bad course of disease. This happened with a yellow fever, for example. People would purposefully expose themselves so that they could go back to work.
Yeah, it's this idea of going back that really bugs me. It's like, you know, and we're forced into a position now where, you know, people are opening up, governors are opening up their states and falsifying data, and people are forced into their jobs without a choice and trying to protect themselves and not being able to protect themselves. And yeah, it's a real problem. I hope we can help. That's all I can.
I think that Daniel did make a good point, that like opening up a city is different than opening up a university, which is different than opening up a small town where perhaps there's more free space and people aren't living quite in such close quarters. I mean, public transit is used more in New York than I think any other city in the United States. And thus the transmission between individuals in this city, I mean, it seems when you see the subway cars and how full they are in the morning, some of that transmission cycle makes a little more sense intuitively. But I think I would like to end on a note of hope. And I think a lot of scientists and public health practitioners are coming together in order to find solutions. So the Joggle, the Just One Giant Lab, network of scientists trying to work on various types of diagnostics. And I know that XPRIZE Pandemic Alliance is also doing a lot in terms of bringing people together to talk about data and how do we use this in a useful way. Maybe I'd like to learn a little bit more about the Pandemic Alliance, Daniel, and you can tell me what are the data scientists doing to help promote data health?
Sure. It's the sort of general idea of the XPRIZE Pandemic Alliance is to bring together everything from, you know, academics from UCLA, UCI, MIT, to big companies like IBM and NVIDIA, to NGOs, to small startups, to telecompanies, to go, okay, what are folks doing? How do we collaborate instead of compete? How do we find the gaps and connect the dots? And some of that is very much data driven. One of the things we're involved with now is there's identifying folks who've had COVID, who have antibodies, who want to be donating their plasma for convalescent plasma, which is being used to treat often sicker COVID patients. And again, you know, connecting the data sets and the platforms and catalyzing that. There's also part of, and you can go to, I'll put in the chat, covid19.xprize.org, and share the ideas, initiatives, and even data sets if you may have them, because there's a data collaborative that's built where there'll be challenges and ability to access that to find and connect the dots on data to help solve and collaborate. So it's a pretty broad alliance with a lot of different initiatives, and some even a testing prize may come out of it relatively shortly on how do you specifically get schools, like local, you know, schools of less than 500 folks tested and back safely, and testing the tests and encouraging and pushing the envelope for, you know, under $5, under 12 hours, relatively accurate, that can get in the integration of data and apps and personalized data flow lead to solutions that can scale. What playbook's going to work? So Bolinas in Northern California was a town where they tested everybody for serology and found almost nobody had it. So that town could sort of reopen in a forum. But they learned a lot. It wasn't just about doing the molecular tests or the antibody test, but the whole system of how you test, how you communicate, and making that local to that particular community and demographic.
Yes, now we just need to do that for all the rest of the towns and cities around the world. We do have a question here that I think is a little bit related, and feel free anyone to answer this. How do you think the future of college lectures and labs will be like after the pandemic ends? And I think a little bit of this is the management of operations that Craig was talking about in terms of maybe managing people and numbers of people that can gather, having some be virtual and taking shifts, for example. But I'm not sure if you guys have additional thoughts on how this might work in terms of the education space, where that one-on-one mentorship can often be extremely important.
Yeah, I feel like I'm taking up too much space here, so forgive me. But if organizations like universities implement these sort of three-pronged controls for bringing people back to work or bringing people forward to work, we can definitely prevent the spread, or, basically the idea is to stop a new cluster from arising, right? You do not want your university to have a cluster in the name of education. And I think that having these occupational safety and health departments sort of weigh in, like you would around drug testing, right? Like you take drug tests to go to work. It's a similar thing. You get a COVID test for virus. If you're positive, you get your notification on your app and you quarantine or seek medical attention through your primary care physician. If you're negative, you're allowed to come back. And there's even universities that we're working with now here in New York that are talking about linking the results to RFID chips based on identification codes on their badges, where they will not allow someone into the building if the result is positive, right? So I think there's really cool ways that, science and technology are coming to protect people in the workspace.
Very interesting. And another question, how do you propose protecting those over 75 who are at greater risk for more serious illness? And I think some of the contact tracing that we've talked about, maybe even digital contact tracing might work in this regards. Not sure if either Nell or Daniel have
one piece of that briefly is that it's not just your age. We're learning that, your genetics, maybe what blood type, HLA types you have, underlying diseases, obviously some play more role than others. So you may have a 75-year-old that's relatively lower risk and higher. And there's several initiatives crowdsourcing genomics, looking at who's gotten sick, who's survived, who's been asymptomatic. We'll start to identify the folks who are relatively protected and those who are at severe risk, and not make quarantine or isolation, one size fits all, and then potentially use other tools. And then back to the question about briefly on education, that includes educating everybody about this new world. There's not just a pandemic, but an infodemic. The anti-vaxxers are going to be coming out in force. They already are. I joked on Twitter, or thought I was joking, that what's the mortality or morbidity of Fox News viewers versus CNN versus CNBC? Turns out that's been studied, and it's higher. So where you get your information,
really,
the trust you have, is different. And so we have to be mindful about, we may have all the best science and solutions out there, but if they're not adopted, people don't vaccinate. Hopefully when we do and get a vaccine, that we're going to be in bigger trouble, and that has big geopolitical challenges as well. On the plus side, education is being enhanced and maybe democratized, and the ways we're doing virtual meetings and one-on-ones is going to get much better than Zoom, and that has positive elements to get people educated who weren't going for.
Yes, absolutely. I think that this time in history is when virtual reality is going to find its killer app, which I believe is actually education and training. The thing about learning something is that if you can shorten the loop between when you experiment or try something and you get a result, then you can make that training much, much more efficient. If you think about teeing off in golf, or even just throwing a frisbee, right? If you're doing that in physical reality, you have to go and chase after something and collect it, right? But if you're doing it virtually, you can do the same motion, the same attempt, 1,000 times in a row. And of course, VR can be collaborative. You can have people coming together to collaborate on a problem, whether that's engineering, whether it's medical, you name it. And so I think that VR is going to be an essential aspect of how we train people now going forward.
Including for health. You can train virtual surgeons. You can use VR for therapy, including for mental health and stress. There's one called TRIP, T-R-I-P-P. If anyone has an Oculus Quest, try out this new app called Supernatural, which I've been doing for a month. It's VR exercise. It's like Beatmaster on steroids, where you exercise. It connects to your heart rate detector on your Apple Watch. It's very engaging. So there are ways we can amplify health using VR and AR and education. So try those things out, including virtual ping pong, which is feels quite real.
Oh, that sounds great. So I want to do a round robin to just ask everyone, let's say 5-10 years, how do you imagine some of these technologies that we've been talking about will affect, we've talked about education, maybe think about another area where you think that this is going to be incorporated. But before we do that, I just want to make sure that all of our attendees can find you. So maybe you want to also say where you are online, if you have a website or on Twitter, or, where else can they find some of your very excellent thoughts? Nell?
Sure. I put some thoughts, essays, videos, etc. on nellwatson.com, Nell Watson.
Wonderful. Craig?
Yeah, you can find everything you need to know about Renegade Bio at renegade.bio, or stalk me on Facebook, and you can hear my personal thoughts, which are far more political and entertaining.
All right. And Daniel has put his website into the chat. But Daniel?
DanielKraftMD.net, or Twitter, Daniel__Kraft, or at Exponential Med. Lots of ways to track me down.
Wonderful. All right. So we've got 3 minutes left. So let's hear just your tweet-sized bite of what you think is going to change in the future. Again, not just the immediate future, but more long-term. And now I'm going to jump over to Craig.
Yeah, I think in the short term, I see testing, tracing, and tracking being a large part of our life, and I see it. I mean, it's a long-term vision of track and trace and test, and 2021 before we have a vaccine. I think that, like I said earlier, I hope that we carry the lessons that we've been so lucky to learn through this pandemic with us as we go forward. So, and from a sort of political, social, community side, I hope that, yeah, we remember how to take care of each other and do that.
Excellent. Daniel.
I'd say let's say imagine 5 years from now, or even sooner, we're going to have a much more smart, intelligent, interconnected era of virtualized health that includes public health. Mm-hmm. I always like to use example of Google Maps and Waze. I mean, most of us can still remember driving with paper maps if you're old enough. Now you can imagine getting around without Google Maps and Waze, and that gives you the traffic. It's all sharing data from other people driving, their speed and location. From that, you build a map of traffic and how to get to work or avoid an accident. But now imagine we had a Google Health or Waze for infectious disease, non-infectious diseases, that gave you guidance from others and like you, around you. And that personalizes the interface. Imagine your personalized avatar chatbot that's living on your digital devices to give you proactive warning about, wow, this is a high COVID infected area, a red zone versus a green zone, that can sort of look at your nibbles of digital exhaust from your wearables to your voice and find things early from infectious and others. And that connects to this larger healthcare ecosystem. We're all sort of crowdsourcing and building that real-time map, so that if you learned a lesson in Wuhan or in the ICUs of Italy, that translates much faster to the intensive care units or the outpatient clinics of Palo Alto or New York or Calcutta. So I think this sort of more blended, smart, integrated system will be part of that. Hopefully,
yeah, I like that translation of learnings. Excellent. Nell, please.
Robotic avatars. I happen to be a judge on the XPRIZE, or ANA Avatar XPRIZE, and the entries are very, very promising. So essentially, the prize looks at developing a very sophisticated robotic avatar that you can put on your head-mounted display and go and do things in the world as if you were there physically. And this year has shown us just how important those kinds of technologies can be. And so we're seeing a confluence of battery tech, robotic tech, AI tech, and head-mounted tech coming together. And that's going to create even more opportunities for leveraging all of the talents that we have around the world in many different countries, and new ways of bringing people together to solve very complex problems. I'm very excited about that, and that's where I see the world being in 5 to 10 years.
Oh, that sounds wonderful. So we'll have to all gather again once we have our avatars and have another discussion in this sense. I'd like to thank you all, Daniel and Nell and Craig. This is really interesting. I learned a whole lot, and I hope our attendees did as well. And so thank you for your time.
Thank you so much. It's been a pleasure. Really great meeting all of you.
Stay safe, and keep innovating.
Yes.